Hello, everybody. Thank you for joining us today on this webinar, which is going to be about Introduction to Value-Based Medicine. My name is Dr. Avinash Jaiswal. I am the newly appointed Chief Medical Officer in the company. Very glad to have joined. I'll start out by introducing myself and then introducing the panelists. So a little bit about myself. I am a doctor with quite a bit of experience, both in inpatient as well as outpatient settings. I've worked as an ER physician and in surgery, as well as had some experience working in family practice as well. Hence, I understand the providers in the outpatient, as well as the constraints and challenges of inpatient settings. I joined as CMO to bring my experience to the job and to contribute in what is now the new norm of value-based medicine. Our Chief Operating Officer, Stan Gutkin, is amongst us today. He is going to just watch me present as I go ahead and introduce our speakers. So Dr. Beran Erdik, who spoke already last week, and he will be speaking again. So he's our advisor on regulatory compliance and practice transformation with focus on value-based care. He's an expert on policy and health administration and is actively involved with compliance both at the state and federal levels. I'll also introduce Dr. Manijeh Berenji, who's advisor on risk stratification and clinical outcomes. She's double board certified in occupational and environmental, as well as preventive medicine, currently now moved to California, in the Los Angeles area, as opposed to Boston. I guess it's a good time to move before the winter. And Beverly Gibson, our advisor on medical documentation, billing, as well as revenue cycle management, vastly experienced with audit, risk mitigation, and medical record auditing. She has expertise in multiple medical specialties and knows all the three code sets, namely CPT, ICD-10, and HCPCS. So without further delay, let me introduce Dr. Erdik, who will start us off.
Hi guys, as Dr. Jaiswal introduced, I'm Dr. Beran Erdik, and then I've been CCM Health as the advisor for regulatory compliance and practice transformation, and with a particular focus on value-based healthcare. So we'll be discussing some key changes that have happened in the recent couple of years here. So most important is you may have heard some of these MACRA, MIPS, FFS, PCMH, and all these good abbreviations. So time is now to take action. That time is of crucial matter because we only have a couple more months left till the end of this year. And to remember, we will be scored 2 years after the fact. And with that, I give the mic to my colleague, Dr. Berenji, who will go through some use case scenarios and try to put this more in a clinical perspective instead of just like an overview from a more regulatory perspective.
In his or her own health. So really trying to provide that to each and every patient can really, really kind of help individual clinicians who are trying to monitor what's happening with their respective patient, but also on a population level, having all that data is really informative because it can guide your practice model. So incorporating the equipment, the software elements, all of this does come together to really create a robust chronic care management program. Next slide. So we're just gonna kind of highlight a case here. So we have Miss Maria. She's a 74-year-old female. She lives by herself, but she does have family nearby. She does have a few medical conditions. You know, we want to make sure that she's doing okay. She has 4 diseases. She has multiple medications, as you can see there, 22. She has 20 healthcare providers. It's hard to kind of keep up with Miss Maria because she has a lot going on. And, you know, being able to have a place where you can consolidate all the specialty consultations, all the respective lab work, all the medication, and the respective reconciliations. Kind of being able to look at trends over time on one platform can really help Miss Maria continue to lead her best life.